There are different types of diabetes. There's type 1, type 2, and gestational diabetes. Type 1 diabetes directly insults the pancreas. The pancreas becomes very inflamed, potentially infected, which is a major theory for type 1 diabetes, and the pancreas shuts down. It is therefore required when people have type 1 diabetes that they need insulin. So this is a lack of insulin production in its most severe form. Type 2 diabetes is a huge bucket term. Usually type 2 diabetes is related to insulin resistance, but oftentimes it's actually evaluated by how much blood glucose levels are, or how much there is a certain marker that looks at blood sugar in the circulating blood. So those are really kind of the same thing. They just kind of have two different markers to evaluate them. Then in gestational diabetes, there is a lot of stress on the female when she's pregnant, and gestational diabetes shows that. So about 20% of people, I believe, of gestational diabetes will go on to develop type 2 diabetes. But it has to do with some dysregulation of how carbohydrates are processed when a woman is pregnant. Okay, so there's definitely very important to test regularly. It's very important in any metabolic dysfunction to try to figure out as soon as you have it, or if you're trending in that direction. And then recognizing that family history plays a role, often because that's how we learn to eat, sleep, take care of ourselves or not. And also, a lot of our habits around holidays and such come from our family.